I'm Dr. Alok Sharma, Professor of Neurosurgery at the Lokmanya Tilak Municipal General Hospital and Medical College and Director of the Neurogen Brain and Spine Institute in Mumbai. I'm founding President of the Stem Cell Society of India. The Stem Cell Society of India was set up to get all the people working in the field of stem cell together in one platform so that we could work together to look at each other's results, to learn and teach from each other, but also to set standards so that we have basic standards of quality control, of safety, of indications. It is also meant to be the body that will liaise and communicate with the government, in particular the Drug Controller General of India, the Indian Council of Medical Research, the Ministry of Health, because stem cells is a very grey area. There is presently no law in the country. So on one hand, there are people who are just about doing anything. On the other hand, there are lots of people who want to do things but can't because the regulations are grey. And we believe it's time that we had clear, well-defined regulations. And those of us who are working in this field need to be able to contribute by sharing our points of view with the government, with the ministry, so that standards can be laid down. It's my belief that there should be three criteria. There should be a permissive criteria, like a green signal, where by an automatic route there's something that you're allowed to do, in particular with autologous cells and minimally manipulated cells. There needs to be an orange area, an area where you can move but with restrictions and guidelines, and this would be the area of umbilical cord cells. And there needs to be prohibited or very restricted areas like embryonic stem cells. So when you have this, then you have safety is maintained, quality controls are maintained, and there is freedom for individual physicians and surgeons, transplant surgeons, to do what they believe is right. The whole problem really is that on one hand you have a treatment which is still considered by many to be unproven. On the other hand, there are patients who are dying, patients with Duchenne muscular dystrophy, patients with motor neuron disease. These are patients whose lives could be saved if stem cell therapy was more easily available. And it's a real tragedy that people are dying today despite the availability of a treatment. There is absolutely no logic or rationale to that, and this is basically because the regulations are coming in the way. So I believe the Stem Cell Society has a very important role to play in establishing standards, making our own internal guidelines, and being the connection with the ministry and the government as to the way the stem cell treatment has to go forward. Stem cell treatment, I believe stem cells is the future of medicine. It's the next step in human evolution. It is believed, and there are reports, that human life longevity may increase to up to 150 years or 200 years with the use of stem cells. And already there is work in the anti-aging field where people are using stem cells to both increase their longevity as well as quality of life. A whole lot of diseases which were earlier untreatable, from autism to cerebral palsy, from muscular dystrophy to motor neuron disease, people with brain strokes and dementia, people who are paralyzed with spinal cord injury, kidney diseases, liver diseases, diabetes, orthopedic diseases. There are so many illnesses for which there were no treatments, but now with cell therapy this is possible. And I think with the greater availability of stem cell therapy, there will be nobody living on the planet who will not need or use stem cell therapy in some way at some stage of their lives. So it's the next step in human evolution, it's the next step in our health, it's the next step in the prevention of disease, and it's the next step in improving both the quality and quantity of our lives.